Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy. Welcome to today's segment about popping yourself or cracking yourself and why this may or may not be a good thing. And so traditionally, a lot of people believe that popping is a realigning. And so we're trying to realign the joint itself and get it into the right place. Now the question is, why does it need to be realigned and how did it get out of alignment? And then the next thing is, how do you know you're popping it into the right place is what I always pose to patients here.
So typically when people are trying to achieve a cavitation, pop, or adjustment is the facet, actually the little capsule right here. And so they're trying to do this. Over time, there's ligaments that are actually holding these together, and the capsule that is connective tissues are trying to keep it together. And so when you do that over time, you're gonna create, or if it's out of alignment, as some would believe, is that you're popping it back to place. And so what sometimes is the victim is the nerves and the discs themselves, and that's where it gets in trouble. There's been studies out there that it only takes as little as 40 pounds of compression and torque to rupture and start breaking down the discs. Whereas alone, just compression for the discs is about 2,000 or 3,000 pounds. I might be misquoting it, but I remember reading it somewhere. And so, like I said, there might be a time where there's a pop that you may not like, and you can see this one's just been unstable for some time. The ligaments are broke and torn, and then what happens is it gets here, and then what happens is, yeah, you can get it back, but you can see that the disc or the nerves get caught, this gets impinged, and then you start getting those sciatic. So this is a good representation of just you being unstable and things being torn. And what is going to help things that are torn is having the muscles do their job. And there's a bunch of core muscles that really need to be stabilized here. So this is a good representation of popping too much and the reason things are popping, and you want to get things in the right place at the right time. So you want to use this and you want to get proper adjustments only when it's needed and precise.
So there's different ways of popping. You can do what we call a shear method, which is like this, and that's usually never good. We don't like that because that just kind of starts scuffing the joint and maybe even breaking down the cartilage. And then there's a traction method, which is actually a little bit better. You want to be a little bit more, so it doesn't create a friction on the joint. And so realigning it creates also, the pop itself also creates some endorphin effects, and so it feels good, and you think you're doing well, and then you walk out and then someone honks their horn at you in the car and then you tighten right back up. Well, that's a problem. That's a number one kind of little tall tale sign that things probably are a little bit different. And you might have noticed back before you started popping that initially when you pop, it was a lot more difficult, and then it got easier and easier. And now you have to do it all the time, 50 times, 60 times a day. You become a crack addict, is what I call it. So you don't want to be a crack addict. And what really needs to happen a lot of times is that the ligaments, in theory, are getting stretched. And so we have a theory by this researcher named Punjabi. It's a triangle. It's about 1/3, 1/3, 1/3. One of it is passive structures, which is the joints and structures, ligaments themselves. Another is the muscles, active structures, and then another is what we call that brain-to-body awareness, that neuromuscular. And if you start affecting the passive structures, then it makes it very difficult for the active structures like muscles to really engage and have the proper length tension. That's what starts happening. So then you essentially have either maybe 33% or 0% stability. So that's what we're looking for. We really want to get those things stabilized and really try to hone in on not having to pop. I always find with my patients here that you want to stabilize first, and then if you really need to mobilize it, that's when we'll go after it. But most of the time, you got to strengthen and stabilize these things so you don't have that need. And a lot of patients, I tell them, you got to stop. It's hard for them to do it initially, but once they realize that the strengthening is underneath it all, that is the missing piece, and the stabilization, then the popping or the need to want to pop stops. So you want to be able to think about, are you really popping in the right place? And most of the time, I always tell people, there's one day you're going to get a pop that you're going to regret. And it happens to a lot of my patients. They keep popping it one day, it just pops too much, and then they either create a bulging disc, or what happens is a displacement of the actual joint itself. And that's no fun. And how do you know, like I said, how do you know you're popping it in the right place? So hopefully this was an informative segment. And if you like what we're doing and you have any questions, comment below, leave a like. Remember to subscribe to our channel. Remember, I'm Dr. Lin of Rehab and Revive Physical Therapy. We can and we will get better together.